In the state of New York, mental health is a prominent issue, and ensuring that there are resources available for people is a problem that has not been fully addressed. For most citizens, mental health support depends on more than just needs. It depends on proximity, variety, wait times, and especially costs. Access to programs across the state varies drastically based on the county in which a person resides. I dove in to figure this out, and here were my results. So here is our raw data of every single mental health program in the state of New York. It gives you all of this information, and this was produced by the New York State Office of Mental Health. You get all of the different program names and codes, including a lot of phone numbers and only very some addresses because a lot of programs were worried about privacy and wanted to keep their privacy safe. So it was hard to work with a lot of this. The one thing that each program gave was their county. And so I took that and put it into a pivot table, as you can see here, where I have each program county, and then I took the population of each one of those counties and calculated the programs per capita of each one of those counties and then ordered them to put it on a singular basis to understand how much each one is worth compared to the other counties in the state. So you can see Hamilton here, which is a more rural county, is the highest by far. Then if you scroll all the way down here, you can see that the New York counties, including Queens, Kings, Richmond, New York, they're all towards the bottom here, which is really interesting considering it's the biggest city in the state and in the country. So you'd think that they would be very good at this, but they're really not. And this number here, 2.31 and more, that is the number that is actually that is the calculated number of the entire city of New York, combining, taking the average of all of the different counties. So interesting to see how we have these different variations between them. So with that data that I had, I took the process data, and made visualizations out of it. This first one, you can see up here the number of mental health programs in each New York county per capita. You can see number one is Hamilton, and look how much bigger it is than every single other program. And after that, it's a pretty steady decline, but not as drastic of a drop from Hamilton County, which, as I mentioned earlier, is is about 11 more programs per capita than second, which Franklin. And so really interesting to see, and you can hover over each of these and see how much each one, the actual number is. And the second visualization I made was a map of each county in New York, and the bubbles in each one represents the size of the bubbles represents the size of how many programs there are in each programs per capita there are in each county. And so as you can see, biggest one here's Hamilton, and it's way up here. So it's not near necessarily any big city. You've got Buffalo over here, Albany around here, Syracuse here, Rochester around here, and all the way down here, the smallest circles, New York City, Richmond, Kings, Queens, Nassau, New York, Bronx. So pretty interesting to see how it's just completely drastic. And so that's what I did in terms of these. And what I did afterwards is I decided to talk to an actual individual person who lives in New York City, Jonathan Gorin. I had a conversation with him, and he told me about his experience with mental health programs in the city. Do you feel that mental health support is easy or difficult to find in your county?
I think it depends on where you are. I'm sure if you go to if you go to a university or or a K through 12 school here, then yes, I'm sure you can go to your counselor and be like, or whoever, and be like, I need this. And they'll be like, oh, here's XYZ. Here's a million things you can do. And here's sponsored by the school. Here's sponsored by the state. Here's sponsored by the city. But I think for like me, an adult in the workplace, while my company does offer services like that, I personally would feel awkward asking my company for that. Um, and I haven't seen much online.
Why do you think that there is such a low amount of mental health programs per capita in New York City?
Like, there's a reason why rent's so high, right? Because everyone wants to live in this one place. I think it's the same with the mental health programs. Like, everyone wants to live here, but there's not enough to accommodate the demand.
Do you think that this data tells the whole story, or are there other factors involved?
I mean, there's more to the story. There's definitely people that seek help and don't find anything and don't report. There's other people that have a crisis, don't report. Um, I'm sure there's like private one-on-one sessions with doctors that are just, word of mouth.
What do you think people should know about mental health accessibility in New York?
I mean, if you don't have insurance, you're screwed, and especially if you're held against your will. Like, I can't remember the the 5150 equivalent here, but like, a cop deems you, dangerous to yourself, and they put you in a psych ward, and you're stuck with thousands of dollars for something you don't want.
What does good mental health support mean to you?
Follow through and commitment, and then you can definitely tell when the therapist or doctor, whoever you're telling to, is like actually cares, or they're just trying to do the check boxes and get you out. Um, like how the skills, and I think like honestly, like when I did outpatient, they would give me like homework, and I think like just like following up on that, just making sure that you do what's assigned to you.
Thanks so much for talking with us today, John. We hope you take a look at your county or area and see if you're having enough accessible mental health.